Good morning and welcome to our fourth virtual town hall devoted to 2020 planning activities here at Johns Hopkins University. I'm Janet Schreck, Associate Vice Provost for Education, faculty member in the School of Education, and one of the team members leading our 2020 planning efforts. I'm delighted to be moderating this session today with four of our distinguished university leaders: Andrew Douglas, Professor and Vice Provost for Faculty Affairs; Stephen Ganji, Executive Vice Provost for Academic Affairs and Professor; Nancy Cass, Professor and Vice Provost for Graduate and Professional Education; and John Links, Professor, Vice Provost, and Chief Risk and Compliance Officer. The goal for today's session is to discuss general issues related to return to campus instruction. Yesterday evening, the university released a set of draft guidelines describing what course instruction may look like across the various phases of density restriction. In addition, university leadership communicated this morning its commitment to opening for some form of both academic instruction and student life this fall, recognizing the difficulty in predicting the various public health and regulatory factors that will play into those decisions. Accordingly, the instruction guidelines advocate for preparation of instruction with mixed modality, regardless of density phasing, as well as the need to ensure that academic community identity remains strong despite the challenges to connection. The guidelines that were posted are based on detailed recommendations and analysis from the 2020 Academic Programs Continuity Workgroup, comprised of faculty, academic staff, and support staff from across the university. The guidelines should be considered in conjunction with the draft Return to Campus guide, which was published last week, that contains additional guidelines about topics such as maintaining an inclusive workplace, altered staffing and scheduling plans, augmented cleaning protocols, required physical distancing, and universal face coverings. Our guidelines are not the final word. It's a draft intended to spark discussion, feedback, and revisions as we consider the many issues presented by the complex and diverse operations that is Johns Hopkins. The guidelines will evolve over time as circumstances warrant and will provide the basis for the local plans and protocols being developed by each school, department, and program. It is not our intent today to delve into the topics of undergraduate residential living or the specifics of how particular undergraduate or graduate programs will be offered. The leaders of those programs are actively applying the draft guidance from this document and others to formulate those plans, which will be shared with the community and discussed in town halls over the next several weeks. In our announcement for the session, we asked you to send us questions beforehand, and we've appreciated the many we've received. Below the screen is a box that will allow you to send in questions in real time. We will answer as many of those as possible during our allotted time. Like other sessions, this town hall is being recorded and will be available for asynchronous viewing. We will also work to use the questions we've received to put together frequently asked questions that will be added to our planning website. So let's go ahead and get started. Stephen, I think we'll start with you and ask you to give a general overview of the guide that was published yesterday.
Thank you, Janet. So I want to just set the scene and certainly reserve enough time for questions. So the guidelines that were sent out yesterday is not a detailed plan for each school. And it's important to recognize that what we can talk about today are the parameters that will help guide those individual plans, but aren't the plans themselves. So many groups are working on this, and many more details will be forthcoming over the next several weeks. The document that we sent out talked about how we are doing this planning. We've set forth a number of guiding principles that are helping to frame our decision making. We have emphasized in these town halls that we need to plan for different public health phases. And so the report talks about the importance of planning in case we need to be off campus, as well as what we hope in the fall, public health situation will get to a stage where we can have in-person classes. As Janet mentioned, we are advocating for the preparation of instruction with mixed modality. Online remote will be important, but even if we do come back to campus, online and remote options will be an important component of our instruction. We want to ensure that we are thinking beyond just academic instruction and thinking about other aspects of our maintaining an academic community. We want to be sure that we are accommodating instructors and students who have particular vulnerabilities in an appropriate way. So the guidelines talk about how our accommodation process will work, as well as adjustments that may need to be made for both instructors and students. There are a number of concerns with regard to international students that are covered in the guidelines. And then lastly, there are a set of applications of health and safety guidelines that have been previously discussed in the Return to Campus document as applied to instruction and classrooms. So for example, one of the most important aspects of that is the physical distancing requirement and what that will do to classroom capacity. So that's been an analysis where we followed existing guidance to ensure that there is 6 feet between students in a classroom, as well as between a faculty instructor and students. That sets up a set of parameters for evaluating how classroom capacity may change, and as demonstrated in the appendix of the report, points to a very reduced capacity that all of the divisions are now taking into account as they're putting together their plans for fall. So that covers the material in these draft guidelines. As Janet said, these are draft. These are out for the community to comment on, and we very much appreciate all the feedback and input on these as possible. I'll also just point out that the president sent around a message earlier today, talked about some aspects of what we know right now. I know that in a question from many students has been the time frame whereby we can ensure that we get out decisions. That message mentions that the detailed plan for academic instruction will be provided at least by the end of June for comment and feedback, so that we can make final plans by mid-July. And so, I think we all realize, the intense interest in that. The divisions are working very, very diligently on their preparations for fall. So with Janet, I'll turn things back to you.
Thank you, Stephen. Just to dig into some of that guidance a little bit more based on some questions that came in before the town hall, to what extent do we think there will be on-campus instruction in the fall? And when will we know more about that, and how will those decisions be made?
So let me start and then ask the others to comment on that. So the guidance recommends preparations for different phases, right? And so that all the schools will be prepared if things are, again, in a positive trend, and we are developing right now the metrics that will help us to evaluate the safety for offering in-person instruction. I think that schools are looking at their classroom capacity, are looking at other aspects of what they're able to offer, and putting their plans together, as I said, that will be shared over the next several weeks. So there is, I would say, each division, each program is looking at that carefully. I don't think any of us can make a commitment that that there will everything will be offered as per usual in-person instruction, but the divisions are evaluating their possibilities, again, according to the guidance and guidelines that we've put together.
I guess following up on the question about timing of opening, there's some confusion and questions around the fact that the state, Governor Hogan just announced the state is moving ahead in its phasing. We haven't yet heard from the city. How does that impact the return for instruction and our stance about what's open and what's not open, either to Stephen or maybe John for that question?
John, do you want to take that? John, you're on mute. I'll take that. I'll start. There are certainly things that we can control and things that we can't control, right? The aspect of, continued community transmission and the virus itself is something that we can't control. Right now, trends are in a favorable direction, and the state is making steps along the lines of continuing to open up. We believe that there will be a message from the mayor's office later today that will also offer some opportunity for continued opening up. Right now, we're still at an early phase in opening up. Our 4 summer activities have already made the decision that all of our instruction will be online and remote. And what we're hoping for is, again, things will continue to improve so that the state will offer an ability for us to offer instruction in person coincident with the beginning of the fall term. John, other things to add to that?
Just to be clear, so we are never going to be ahead of either the state or the city. The state is ahead of the city in general. So if you only pay attention to the state, it's going to be misleading in terms of our operating posture. So we have to be in concert with both the state and the city. And when the city lags behind the state, we're going to be governed by the city.
Fair to say also that we will always be clearly communicating what situation is happening in advance of it happening. So for instance, as we anticipate phasing back into some return to research, there will be clear communication with some notice prior to that happening for the community.
Yeah, and it's important in our planning. Several weeks ago, Denny Wirtz, our Vice Provost for Research, and his team put out a return to research guide that set similar guidelines for laboratories and other facilities to begin the return to research. Now with the state's change in order and the anticipated city changes in order, we anticipate to be able to embark upon research restart in the next several weeks, and more communication about that will be coming out shortly.
Thanks, Stephen. Back to the topic of return to instruction. We've had several questions both before the town hall and today related to if I'm a student and either, I'm going to give 2 scenarios. One is I'm in a vulnerable population. I am at risk for returning to campus for instruction. What happens to me? Do I have to come back? And then the second follow-up is, what if I may not necessarily fit those categories, but I just don't feel safe returning to campus? Are there going to be accommodations made for students like me?
Nancy, do you want to take that?
Sure, I'm happy to jump in. Thanks, Janet, for the question. I think, let me frame my comments by saying that certainly we at the university level, but I know every school and program also is committed to this combination of quality and flexibility. And that is a set of values that everyone is trying so hard to continue to emphasize in planning. So in that context, with regard to the students, there certainly are mechanisms for students, for example, with pre-existing conditions to confidentially alert the Student Disability Office about that. and to ensure that there are appropriate accommodations made in every program of the university. We recognize, however, that there may be at least as many students who don't formally have the kind of pre-existing condition outlined by the CDC as being a risk factor for COVID, but as you say, either because of travel or visa issues, or honestly because of personal decisions related to what makes them comfortable or uncomfortable about current risks, will prefer to stay at home and not come to Baltimore for on-campus instruction. My sense is that every program of the university is identifying ways to continue to have a quality experience for every student. That will be put into practice in a variety of ways. And some of it will depend on what's going on in person for each of those classes and extracurricular experiences. But as you'll see when people have more of a chance to look at this report Stephen described, there will likely be a menu of different kinds of offerings that are provided both in person and online and as hybrid, including, for example, that there's an in-class section, but some students are also participating remotely, either synchronously or asynchronously. I won't go into all the options, but the overarching theme is that every program in the university is fully aware that there will be some students and some faculty who are unable to return in person, and there are deep commitments to trying to maintain quality in that circumstance.
Thanks, Nancy. I'd like to send a question to Andrew as a follow-up to that, from the similar question, but from the perspective of a faculty member or maybe a staff member coming back, who again may either fit one of those categories and feels like I really am at risk to come because of those vulnerabilities, or I just don't feel safe returning to campus. How are we planning for that, Andrew?
So Janet, thank you. And let me first say good morning to everyone. And I do want to recognize the difficulties faced by our community, too many of whom are really challenged by both the pandemic and by current events, and just acknowledge that we in university leadership haven't lived up to our commitment to communicate to you as effectively as we should, because we are also struggling personally and professionally with multiple crises right now. And we really do understand that the community is challenged. And for those of you who are persevering, just thank you very much for all that you do for each other and for this institution. So let me come back to Janet's question, which is, what about faculty or staff returning to campus? And so essentially there'll be two paths to accommodation. One for students, one for faculty and staff. The accommodations will be both medically based, if you like, the CDC guidelines, and also those who just don't feel that they can do things appropriately on campus because of their circumstances. And in both cases, essentially, there's an accommodation discussion that goes on with the staff person, with the manager, with the faculty member, with whoever's running their program, whether it's a homeward program, it would be the chair of the department and the director of undergraduate studies, the director of graduate studies, as to how to accommodate that. And so this takes different forms in different places. If you look at the Peabody Conservatory, they are working extremely hard to have low latency communication where a faculty member and the student are isolated, but that low latency will require the faculty member to return to campus in an isolated room which has been disinfected before they arrive. So there are ways to mitigate risk and concern, and all of those will need to be worked out at the school level because each school's pedagogic difficulties are so different, right? We've got Peabody, who never thought of themselves as being dangerous faculty, but if you're a singer, you could be a super spreader. Some of the faculty are used to working with dangerous pathogens or toxic chemicals, and we now have a very different landscape, and each school is going to have to look at things very differently.
Thanks, Andrew. Stephen, I've got a question for you about timing. We've had several questions about, have we considered, or what are the plans for either starting the semester early, ending early? Could you speak to those plans?
Sure. So right now, again, schools are working on their plans. I don't believe that any of the schools are proposing to start early relative to our regular calendar. And so there are a variety of reasons for that. One is the need to make the kind of preparations to ensure high quality instruction will continue to take time. The other is I think that we've certainly evaluated the forecasting for the COVID pandemic, and there's considerable uncertainty. It may, the idea that things might be better because of higher temperatures, or worse because of various summer activities that bring people together in a way that may enhance community transmission, are balancing factors in what the actual public health situation will look like. And I don't think either of those factors particularly are outweighing any decision to modify the schedule from our evaluation. So right now, I think plans are being made to start instruction relative to our regular schedule. Go ahead, John, please.
Sorry, and in that regard, I think there's some confusion when you look at both us and other area colleges and universities. So back to my earlier comment about following the state and the city. So I'll just take as an example Loyola, which has declared it's bringing its students and faculty and staff back in full force in the fall. That is not a decision Loyola can make unilaterally any more than we could. For example, if in a worst case scenario, the governor has to reimpose a stay-at-home order, no college or university in the state is going to be having on-campus activities. So every college and university, no matter what they're saying or announcing right now, has to follow the same rules as us.
Just to go finish the time frame on the back end, there has been some discussion of whether some programs should end earlier. I would say that is being evaluated right now. We don't have any definitive statements on ending, for example, at Thanksgiving at this time.
John, there have been several questions coming in about testing and the reliance on testing as a decision point for opening, and also questions about will there be mandatory testing of students before they return. Could you address some of those for us, please?
Sure. So testing is a topic that actually has a ton of confusion surrounding it, thanks to the media, who are not doing a particularly clear, rigorous job of explaining the different uses of testing. So very, very briefly, there are 3 different uses of testing. The first is for medical management. You get tested when you have symptoms. And that's the mode we're in now. That's the mode we're going to be in the next several weeks as there's increased return to campus for research purposes. The next use of testing, which requires higher capacity than for medical management, is epidemiologic surveillance, when you're testing everyone with symptoms and a random sampling of folks without symptoms on a recurring basis. We do not yet know if we're going to move to that mode in the fall. We would like to, but as I say, it depends on increased testing capacity. The third use of testing is for public health control measure purposes, containment. And that ideally requires that every single person on campus get tested multiple times a week. The notion, particularly in an urban setting like Baltimore, that we would test everyone once when they return to campus, and that would have any utility is a false notion. So we do not have a plan to test people once when they return to campus, but we are trying to build our testing capacity over time such that ideally at some point we could test many people or everyone on a recurring basis.
Thanks for that, John. I'm going to pivot topics, and I think this is really a question to Stephen primarily, but maybe with Nancy's input as well. So there are questions about what type of technology can we expect to be used in instruction in this hybrid type of work in the fall. Are we looking at something different than the experience the students had this spring of primarily Zoom?
So it's a great question, and there's been, a lot of discussion about that. I think it's important to recognize what we did in the last part of spring semester was really a attempt with I think heroic efforts by faculty and student instructors in ensuring continuity of our academic offerings. There were, a tremendous number of faculty who had never had any kind of training or experience with instructing in an online format. Many schools have online instructors. Myself and John and Nancy, have experience doing this at Public Health. But many had not. And so I'm just, delighted to see the faculty's embrace of this, recognizing it's a core mission and our responsibilities to students to start to learn how to use these technologies to ensure continuity. I think that we learned a lot from that. And as planning is proceeding for fall, there is, I think, relearning and retooling that our centers for teaching and learning across campus are helping with. One of them is just to evaluate our technology that we have on campus to help faculty. And the report talks about a report that in the appendix that came out from one of our working groups looking at technologies and approaches for online and remote delivery, and outlines different capacity options that is being taken to heart in the divisions right now to improve the infrastructure. And so there's an infrastructure aspect for technology. There's an infrastructure improvement process that's ongoing for support, because just having technology by itself is only part of the equation. We recognize the importance of support and training that will help faculty to actually use the technology in an appropriate way. So there is, I would say, a lot of work being done to find the best ways to accomplish what we want to accomplish. And some of it is new. So some of it is maybe using classrooms that otherwise are small spaces that would otherwise not be used because they can't be used for a classroom for density purposes, but could be set up as a mini studio, right? And so a faculty member, instead of broadcasting from home, what we would hope is that on campus is open and a faculty member would have access to multiple tools beyond just Zoom to actually improve and make the instruction more facile. And I think we've done some pilots of that. I think the faculty have said they see an improvement in using these tools in how they're delivering instruction, and I think students will see that as well. So I do think that, you know, that is a intentional part of the guidelines that we put into place. We've had multiple conversations with the divisions on this, and we've had commitment from university administration also, and I believe this is mentioned in the message that came out earlier, of additional investments that we're making to address this need. Nancy, anything you wanted to add?
Yeah, thanks, Stephen. I'll just add a couple things quickly. One, in building on what Stephen said, that the university is providing support to schools to enhance their both technological capacity or equip many more rooms within their schools to have cameras and microphones and things like that. There also is investment in the human side of supporting this. And I think we all know that there are many more human beings who are going to be needed to be involved in this mission of teaching high quality academic coursework through multiple modalities at low density when in person. And quite honestly, a lot of that support and expertise has traditionally been provided not only by instructional designers, but also by graduate students. So part of this support mechanism allows schools to also apply for support for this, which I think is really important. The other thing I want to say about the technology is that the additions of technology will be requirements or opportunities for the schools, and there is absolutely no expectation that students would need to invest in any high-tech kinds of mechanisms. For students, it is intended to be seamless, but from the upfront side, we're trying to do a lot of investment.
Yeah, and just looking at the questions coming in, one of them mentions mandatory online training, and some of the divisions are considering that, right? Where they're looking at the instructors who will be teaching in the fall and are setting up training and resources for them, again, to ensure that they feel properly ready to teach in this environment. One other question, you know, related to this had to do with undergraduates and the courses that they should expect. You know, our guidelines are broad, and they are being interpreted by each of the schools, and there is a group that is focused on the undergraduate experience that is evaluating this. With the, I think it's fair to say, with the classroom limitations, with distancing, that will reduce capacity. There will be online classes as part of the undergraduate experience. I think that there's kind of no doubt about that. But what the group is doing is, you know, certainly moving in priority order. What are those experiences that really can't be delivered efficiently in an online or remote capacity, and ensuring that those are really locked down so that those would be strong experiences, and then looking to see what may move online versus what may be in person, and how they can work to make a more seamless instructional model. So that's the kind of planning that's being done right now. I think that, again, we are preparing if conditions are such that we do need to be off campus. We will be prepared. We are hoping that the trends will remain in a positive direction. We hope that the public health situation and state will allow us to bring students back to campus, and the programs are preparing with that as part of the instructional preparations. And again, the details on that will be coming out soon.
Stephen, one more follow-up on this piece before we shift to some questions coming in around safety and cleaning protocols. You know, I think there's been a couple questions around the piece of sort of choice versus assignment. You know, if I'm a student and I'm out of state, can I choose not to come to campus? Also, the other question of who's making decisions about return if there is capacity limitation. There have been a couple questions about, you know, are there certain groups that will be not able to return?
Yeah, and we, have certainly been following, particularly, I saw some questions about international students, which is certainly of concern for both visa and travel restrictions that may still be in place. In the guidelines, we highlight that we do ask our divisions to think creatively on how they, students who may not be able to actually get to campus would be able to continue to the extent possible their academic progress. And a lot of creativity is going on. One division who actually has a large number of students is actually thinking of having sections that would be timed at what would be here odd hours in order to accommodate maybe students on the other side of the world. And so that's the kind of detailed planning that should be coming out in the next several weeks. The issue of the decision, that when it does come down to an individual decision of a student, we recognize that you need to see what the university is offering, right? What has the university or what has a school or a program put together and said, this is what we can deliver in fall. That is what's underway. That's what will be rolled out in the next several weeks. And then students will be able to look at that and then make an assessment and talk with their program and school representatives to talk about, all right, that's the kind of program I want. That's the kind of program that I feel that I can participate in, or I have some concerns. And we really need to see what the schools are putting together, I think, before any kind of blanket statement like that. And so that I think we all recognize that, especially from the student side, you're anxious for that. We recognize you're anxious for that, and that will be communicated soon.
Just to pivot a little bit, John, I'm going to throw this question your way. There have been a series of questions around what I think we're all, nervous about coming back, making sure we stay healthy and safe. Questions about how do we know we're ready to be able to handle the cleaning protocols that have been outlined in the return, both to campus, workplace, and instruction. And how are we going to work on ensuring that the physical distancing, face coverings, cleaning are all actually done by people?
So let me start by acknowledging that the three cornerstones of public health control measures here are face covering, distancing, and hygiene. And hygiene is a combination of hand hygiene, which is frankly most important, and then cleaning of surfaces. The fact of the matter is that most experts believe that the airborne transmission of the coronavirus is much more significant a factor than surface contamination. Even so, we're paying attention to cleaning surfaces. There will be enhanced cleaning of surfaces. We do have the supplies in hand because common cleaning supplies are effective against the coronavirus. So it's not like we had to go out and find very rare types of cleaning supplies. But face coverings and masking and distancing are quite important. In order to have no ambiguity around face coverings or masks, we are requiring that face coverings be worn at all times, indoors and outdoors. The only exception is if you are in a private office and you're in that office with the door closed, you can take your face covering off. But if you're anywhere else in the building and if you're outdoors on campus, you need a face covering, period. With respect to distancing, even in this early return to campus for research purposes, we're using a very conservative criterion of 400 square feet per person. You can't have more folk than that in the labs. When we go to classrooms in the fall, the distancing ends up being 7.5 feet between students and an instructor. And we've gone through all of the rooms to be used as classrooms and have determined, based on their particular configuration, how many students that ends up being. In practice, a way to think of it is that small classes will be held in medium-sized classrooms, medium classes will be held in large-sized classrooms, and large classes will be held exclusively online. And so we will be paying attention to the consistency of masking, face covering, and distancing. We're going to build a cadre of folk who will be circulating and helping people comply with these expectations around face coverings and distancing, and then we'll have the increased cleaning as well. In addition, we're looking at supplemental interventions. For example, our plan is to, whenever possible, increase ventilation and air exchange rate in rooms, labs, classrooms, etc., so that there's much more air turnover and exchange with outdoor air. So we're looking at a series of additional steps to do what we can in a belt and suspenders way to lower the risk whenever possible.
Thanks.
Just to add to that, you know, again, the density matters, right? So we're not only thinking about classroom density, but also building density. And even when instruction resumes, I think there is an assumption that our buildings will not be back to normal, right? That there will still be a substantial use of telework and management of the buildings to minimize density.
And in that regard, if you look at the state's 3-phase plan, and if you look at CDC guidance, they both use the terminology low risk, medium risk, and high risk as you step through the phases from 1 to 2 to 3. We prefer to think of it as low density, medium density, and high density, equating density with risk. So the return to research labs is a low density maneuver. The classroom instruction would be a medium density, not a high or normal density move.
John, we've also had several questions coming in. I'm going to put them all under a broad category of HVAC air exchange concerns. Can you speak a little bit to the preparations around that too?
Yes. So let me just say broadly that our understanding of this coronavirus and of the disease continues to evolve. And so things we might have thought were the most important 2 or 3 months ago, or even 2 or 3 weeks ago, might not be what we're only focusing on now. And the HVAC systems in buildings is a good example of this. So the magical 6-foot rule that everyone's heard about is predicated on an assumption that the airborne transmission from an infected person is mainly through large droplets that are expelled from coughing or sneezing. And those large droplets, because of their size and mass, tend to settle out of the air just by gravity over a relatively short distance. And that's why the 6-foot rule came into being. But as we've learned more about this virus and the way it might be emitted from a person, if you will, we've come to appreciate that smaller droplets that are introduced into the air when a person is speaking or even breathing may also play a role here. And those smaller droplets do not settle out of the air by gravity in the same way as the larger droplets, and in fact can remain airborne, and depending on the airflow in a room, become more distributed in the room. And that's why we're now paying quite a bit of attention to room ventilation and increasing room ventilation. Now, a nice thing about being in commercial buildings is that the building ventilation systems are in many ways quite different from what you have in your home. And so the exhaust air and the fresh intake air are two separate things. And so when air is exhausted from a room, it doesn't get introduced into the next room. All of the exhaust from all of the rooms is going out a common pathway, and then air is being brought in from the outside through a complementary pathway. And so rebalancing the air handling systems to increase ventilation, or the amount of new air that's introduced each hour, is something we're actively doing whenever possible.
Nancy, I'm going to pivot back to education delivery again, and we've had a couple questions around grading. So is the university going to issue some kind of statement about grading policies for the fall?
So that's a great question. And quite honestly, so far, there has not been decisions to change from what I'll call traditional grading. I think there were so many immediate emergency crisis changes made when all of this hit in March, that was the responsible thing to do. And I think the hope is that we are back to a strategy whereby both there can be more planning for what seems reasonable for students, given what will we hope be transparency from faculty and programs about how instruction will be delivered, that we can sort of return to traditional strategies.
Great. Stephen, just as a follow-up to the great discussion about online opportunities, there were also some questions around the difference between remote and online instruction. And I wonder if you could speak to that briefly of, you know, are we defining online as different than remote Zoom in the room instruction? So
you know, this is, you know, if you talk to instructional designers, you know, they have great thoughts on this, and you know, there's a lot of information out in the community. So we certainly view them as different, right? You know, to us, and we have a number of programs across campus that are online modality, where they are, the distinction in my mind is designed to be that way, right? And so we have whole programs where you don't have to be on campus and can continue to go through entire program. Courses that are online courses, to me, are designed to be that way. So that distinguishes them from what I would call remote, which is a way of doing what you're, or trying to replicate what you're doing in person using technology to broadcast. And so this is where Johns Hopkins has a lot of experience across the university, many online programs. We have great instructional designers, and as Nancy mentioned, you know, a lot of capacity from graduate students who have a lot of interest and experience in this as well to help build out our capacity. So I think that, again, in the spring term, we did what we needed to do in a very rapid fashion. I don't think that any instructor, when they started teaching at the beginning of January, would have anticipated what the end of the term would have looked like and how it ended up. You know, it was truly a remarkable pivot. And, you know, again, I really thank I know all of university leadership thanks the faculty for all of the hard efforts that they did. Over the course of the summer, given that we have more time and given our phasing approach and our request for all the divisions to expect possibly different scenarios, there is an opportunity for instructors to approach their course in a much different way than just broadcasting what they would be doing in a lecture. You can start to pre-record materials. You can start to think about designing assessments that may be more appropriate for online or students who aren't in person differently. You can start to think about engagement activities. And there's a great, for online education has been around for, 15, 20 years now, if not longer. And I think there's a lot to learn from that experience with designing engagement strategies, assessments, and content delivery in a different fashion. So that's the kind of work that we have asked our teaching and learning centers to bring to the faculty. To those training, will be not just, all right, how do I use Zoom, but what are the alternatives? Can I record segments of my lecture so that students may view that maybe before a Zoom session, so that may lead to a more engaging type of interaction? Can I design my assessments instead of kind of a high impact test, where closed book test? Maybe I go to more project-based assessment, where I, really think about what are my learning objectives for the course, and can they be delivered in a way that students are working in groups as opposed to a closed book exam to achieve the same learning objectives. Those are the kind of things that I think online pedagogy is pretty robust, now in 2020, that offers a lot of opportunity for different thinking than just sheer delivery of material.
Nancy, would you like to add anything to Stephen's response?
Yeah, thanks so much. So I guess I'm going to direct this to those of you out there listening who are faculty. And I want to say, speaking as a faculty member, that most of us have thought of ourselves, had an identity as in-person instructors, and prided ourselves on trying to have good methods for that. And in that context, have actually never interacted previously with these centers that Stephen mentioned, who have devoted themselves to not only quality of teaching in general, but really for these virtual and online modalities. And I just want to encourage people to go check those out. There's a new website, Keep Teaching, at Johns Hopkins, easy to find. And I will say anecdotally, I am myself teaching a class in July that will be turned virtual that I've always done in person. And I recently did a call with those people, and just in 1.5 hour phone call was given so many more ideas for how to do things like small group breakouts, and how to improve the quality of even a pre-recorded lecture, none of which are things I would have thought of and are really low-hanging fruit. So I think I would just encourage people to reach out to these resources, both for the pre-planned trainings and for a little bit of half-hour coaching, because I just think they're incredibly helpful.
Thanks, Nancy. We've got a lot of other questions coming in that maybe are a little bit outside the scope of the intended focus today, but I want to make sure we acknowledge them and maybe get some quick responses to them. A series of questions, and I think I'll probably throw this to John, but welcome Stephen to jump in too, around parking and transportation. So what's being worked on in terms of parking, and when will we know timing? And are there any additional changes coming to transportation on campus?
So parking is a super complicated issue. It's a super frustrating issue for everyone. We're acknowledging that. We know that. Right now, the posture is that the times when you can park for free have been extended from the usual operating routine, but folk who pay to park are still paying to park. There's a whole complicated series of reasons why that needs to be the case. We continue to study the set of issues, and I'm not saying things won't change, but for right now, there is no imminent change being planned. With respect to other modes of transportation, notably the shuttle buses, the 24 riders per full-size bus rule is in place. We will be monitoring compliance with that in the same way we'll be monitoring compliance on campus, and we will be intervening when necessary. We will plan to have more buses running than usual because of that 24 rider restriction. So even though we're going to be in a lower density, less people on campus operating mode for the foreseeable future, because of the limitations to 24 riders, we know we need more shuttles running, and that's all being queued up.
As well as the sanitation of those shuttles, right, John?
Exactly.
We also had some questions around, when we're making decisions or when do we know other facilities related to student experience are going to open. So things like the library, things like the gym. Again, I'm going to say maybe, John, you want to take a shot at that, or Stephen?
So, there has been some work. Nancy has worked with Winston Tabb on some expanded capacity of libraries as part of the research restart. There will be some, continued expansion of those services in order for not only laboratory researchers to continue their work, but also those that need library and archival resources. And so that will be coming out. Detailed plans of that will be coming out. It is foreshadowed in the research restart plan that was released several weeks ago. Again, I think that we are in the position here where we are about to restart a number of different activities starting next week, and detailed communications will be coming out to the university for what will probably be, a series of messages around all of these great questions with regard to who gets to access the buildings, who should continue to work at home, how will transportation work, what will be the expectations of being on campus, and the kind of implications of the guidance that has come in the research document, the return to campus document last week, and the instruction document that's been released this week.
Great, thank you. I think I have about a minute to go before we're going to hit the end of our time. I think it's important for us to take a moment to say we know there are way more questions than we have answers right now. And that's not a comfortable place for any of us sitting in a town hall as the panelists, or even people who are planning, or you as people who want to make decisions like to be in. But I think it speaks to the complexity of what's happening. So we really do want your feedback. We ask you to please send questions, send feedback through the website and through the various bodies that are available to you, including the Student Advisory Committee and other bodies as well. Because again, I know we didn't get to all of the questions that were posted today. Any quick last words anybody wants to add before we wind up closing up? Okay, so again, thank you so much for all of you who have attended the town hall. We hope you found it helpful. Sorry that we didn't get to all of the questions, but we hope to post additional answers on the Q&A website as we have those available. We will be holding additional town halls in the next coming weeks to address issues around more specifics around the master's level, undergraduate, residential living experiences, and we hope that you will attend those as well. Until then, we hope that you stay safe. We hope you continue to practice good social hygiene in terms of social distancing and maintaining face coverings and hand washing. And we look forward to seeing you at the next town hall.